Hello class, doing today's video on some medical technology, some up-and-coming medical technology. I thought I'd force myself not to talk about AI. I like talking about AI, as I'm sure you know, although this semester I haven't done as much. But this one is about activated nanoparticles using ultrasound. And they embed themselves in bacterial biofilms. So please forgive me if you don't know all this stuff, but bacteria rarely hangs around the body as a bacterium. It usually forms what are called biofilms, and you can see here. This is an example of a biofilm, and you can see little individual bacteria, and it forms just like this structure. And an example of a bacterial biofilm is like plaque in your teeth, right? And I'm sure you've probably maybe scraped it off with your finger and seen that kind of white goo that's there. That is bacteria plus the bacterial biofilm. And what this developing technology looks to do is to take a nanoparticle, so nano being 10 to the minus 9 meters, so nanoparticle, so something that's around 10 to the minus 9 meters, or you can use it to express that a measurement in that regards. And then you can put those in the biofilm. So for here, you can see that looks like some sort of coccybacterium, and then here is the nanoparticle going inside, and then this is probably all part of a biofilm. So now you have this nanoparticle in the biofilm, and then you can hit it with low frequency ultrasound. LFUS is a low frequency ultrasound, and then that releases the antibacterial. And so the idea now, we have a way to take a drug, and we can place it into where the bacteria colony is, and then they can deliver the drug right there. And so the idea is, well, you get more efficient transfer of the drug to the area. Also, you don't have some of the side effects. So I mean, like when I take certain antibiotics, it disrupts my digestive system, right? So that's a very common one, right? The antibacterial doesn't just get your disease; it also gets your symbiotic flora that's in your gut. And also with that, we know that, and this is an emerging field, the microbiome that we have in our own bodies. That's an important thing. It's something we should try and protect. And we're just learning more and more about that as we go along. And so now we're developing technology that we can treat an infection by using a carrier, in this way, a nanoparticle, and then hit it with some ultrasound, and then the nanoparticle will release the medicine into right where the biofilm is, and you can see some of the numbers. It's a pretty promising technology to do this. So see here, the treatment with the nanoparticles using low-frequency ultrasound killed 90% of the biofilm. So without the biofilm, the bacterium doesn't work. Well, it also is going to kill the bacteria as well. So this is interesting now, right? How we can treat disease. We're not just going after the bacteria themselves; we're going after the biofilm. So many of the drugs do certain things. So, for instance, the penicillins, right? Penicillin, amoxicillin, they work by preventing cross-linking of the protein code around bacteria. So you're doing something that inhibits the growth of the bacteria right there. And sulfonamide drugs, for instance, typically work by preventing the bacteria from making folate. And whereas that, of course, that works for us too. We won't create folate, but we can get folate from our diets, whereas bacteria can have to get it. So that's the reason why sulfa drugs kill bacteria. So, but there are always side effects with taking these drugs, and this is a way that we can get the drugs specifically to the infected area for the patient and limit those side effects. Also makes them more effective, so we need less of them. So that's nice. So And hopefully this technology could be used further to do other things. So for treatment for cancers, for instance, and for other things. So this one's talking about the like Ozempic, for instance. So using another class of drugs, not just cancer drugs, but also, I mean, Ozempic is more for inhibiting signals, right? So for preventing hunger. So I think it's an interesting technology. So we're not there yet. So we're not there so that we can this is not something you're going to go to the doctor tomorrow and say, hey, can I get some of those ultrasound nanoparticles to treat my ear infection. It's not, we're not there yet. But this is interesting to see that we're improving things, and we're looking at different things, right? So we're looking to the biofilms rather than just the bacteria themselves, and we're just looking at a way to deliver medicines to patients. And so it just shows you how our medical technology is improving, and what role chemistry has to do in that. I know most of you guys are pre healthcare, and you're like, why am I taking this class? Well, this is one of the reasons why. So because chemistry is useful. So well, I hope you enjoy the article and makes you think how awesome chemistry is, as usual. And but if you are personally not doing as well, you're not feeling as awesome, like if you've are dealing with lack of basic needs, or dealing with crippling mental health, or there's other things going on academically or whatnot, feel free to reach out to me. I'll do what I can to help. So have a nice rest of your week. Goodbye.